right, hello everyone. Monday night, we're back. Hopefully we're going to be going good. Hopefully you can hear me. There's Mercury retrograde out in the universe right now, and I don't know if anybody knows about that, but that makes all communication and everything having problems, and I have been having problems the past couple of months. So hopefully I'm on, hopefully you can hear me, and hopefully we are going to have a good night so we can finish our conversation about STDs.
In the universe right now.
I see myself on my iPad. I do see that it looks like I can hear me. If you're here, say hello. Tell me where you're visiting from. That would be awesome. In the interim, most people know, I always get on a couple of minutes beforehand and I go over, just to make sure that I'm live, make sure that you can hear me, make sure everything is running okay, which I think we're going to have a good night tonight. I also talk about this day in history, like what's going on, what happened this day, long time ago. And so there was a couple of few things, nothing too much, but there were a couple of cool things. We're going to be talking about STDs tonight. We're going to be continuing our conversation. So if you're here, great. Please say hello and tell me where you're visiting from. So in 1964, the Ford Mustang made its debut at the World's Fair. I don't know about you, but I like the Mustang. I'm not quite sure if I would want to get one. I'm a little bit of a Camaro fan, the old Camaros. I used to love them. But I thought that was interesting. If anybody is a soap opera fan, now when I was little, my mom used to always watch General Hospital. And so it's been a long time since I watched General Hospital, but apparently in 2000, General Hospital aired its 10,000th episode. That thing has been going for a long time because I'm getting younger and I'm pretty young, and that means that it's been going on for quite some time. So as most people know, I do always like talking about what women have done in history. So, and this is interesting. A Jerry Mock in 1964, she was the first woman to fly solo around the world. Most of us know Amelia Earhart in her attempt to do that, but it was actually Jerry Mock who actually did that. Let's see. I want to see that. Okay, I want to just make sure. I do see a couple of people are here. Please say hello. Hopefully, I'm seeing you. If you are saying hello, it would be great to hear where you're watching from. Okay, and in 1775. The famous, this was actually Tomorrow because there wasn't too much in history, but in Tomorrow, Paul Revere and William Doss did the famous ride through Massachusetts saying, "The British are coming, the British are coming." So I thought that was pretty cool. Hi Donna, how are you? I'm so happy to be back. Thanks for showing up. Hopefully you can hear me. I think that you can. I did test me out a little bit before. It seems like everybody can hear me. And I had to boost up my internet. As you know, I got this new system, and this new system is so powerful. I had to boost up my internet, and I think that we're good. Thank you, Don. All good. Very, very excited. All right, one more fact from history, and then we're going to start talking about STDs again. For Yankee fans, I don't know if anybody's a Yankee fan, but in 1923, I thought this was interesting. Their stadium opens with Babe Ruth hitting 3-run homers to beat the Red Sox, which the Yankees and the Red Sox definitely have a rival going, and they beat them 4-1. So I thought that was cool. I'm not much of a baseball fan, but hey. So thank you, Donna, for letting me know that you can hear me. I'm very, very excited about that. Let's get started. My name is Lori Faulkner from Women's Health on the Go, where we provide telemedicine for women. So if your gynecologist is busy, typically we can take care of lots of things doing via telemedicine. We can do prescriptions for birth controls. We can treat simple urinary tract infections, vaginal infections, talk about your menopause and stuff. So go to our website, womenshealthonthego.com. Check us out, and if you want to sign up, and you get a free, we have a free ebook that we send out to everybody when you sign up. And it's full of lots of great information. So if you haven't done that, make sure that you do that. And tonight, we're going to continue our conversation on STDs. Now, April is STD Awareness Month. And in my job, I think it's really, really important that, one, we have the conversation, to open up the conversation about it, and we make sure that we all go and get screened. A lot of the times, you're not going to have symptoms. You're not going to know that you actually have an STD. A lot of the times, people will come and they'll be like, oh, I don't need to get screened. I don't have any symptoms. And I have to tell them, well, chlamydia. We had that conversation about chlamydia last time. 70% of women don't even have symptoms of it. So how are you going to know? And if you do have these kind of infections, you can actually, when it comes to chlamydia, you can have long-term sequelae, such as problems with infertility of getting pregnant. So it's really, really important that we go and we get screened, especially, if you're out there dating, you've got new partners, and it's really important to have that conversation with that person and to speak up for ourselves as women. A lot of the times, the condom conversation is a difficult one. It is one where, and I get it, some women are like, I don't like the way I feel. And most of the time the men are like, oh, I don't like the way it feels. It doesn't, it's not pleasurable to me. But, when we have a new partner, we really have to protect ourselves, because we don't know where that person has been. We don't know if they've been screened. How many times sometimes people say to me, but he told me he got screened and everything was okay. And here I am diagnosing them with something. So, I don't need to seem like, I know relationships are hard. I know, especially like in the beginning when you're just, feeling each other out, like, oh, do I like this person? Do I not like this person? And having the conversation about STDs, it can be a difficult one. And I think that it's really, really important that we, as women especially, we are a little bit prone to a little bit more than men. If you think about the female anatomy, the vagina, it's the tissue that's inside the vagina. It just absorbs anything. And then if you think of a penis, there's this little tiny hole at the top, and that's it. There's all that skin to skin contact, but it's not like the vagina. And then, what? Also, if you're having sex with if you're women having sex with women, just because you're having sex with another woman does not mean that you are immune to everything, okay? That is very, very important. I used to work in an LGBT community health center in New York City, and I cannot begin to tell you, oh, well, I'm only having sex with girls, so that doesn't matter. Yes, it does. We might not be prone to some things, but you're still at risk. That's the bottom line. If you're having any sexual contact, I don't care what gender it is, it's important that we get screened. It's important that we know that we are at risk for getting exposure. So make sure, if you have a new partner, if you're starting a new relationship, that you go and get screened, okay? And be open and honest with your provider. In my first talk about STDs, I was talking about how we can get things in our throat, like such as chlamydia or gonorrhea. We can get things in our backside. These are really important. We have to be able to talk openly and honestly about this with our provider and have that kind of comfort with them. What kind of sex are you having? Are you having any penetrative sex, in the backside, in the vagina? Are you having oral sex? Are you performing oral sex? Are you receiving oral sex? If the list goes on and on. And I think that when it comes to a lot of providers, I think we need to educate providers as well, because a lot of people go, oh, you want STD screening? Okay, we'll just write that down. And that happens. There are providers out there who do not feel comfortable having this conversation. So it's just the fact of life. So make sure that you can be open and honest, and you talk about, and you also talk about when you think you've been exposed to something. Everything has an incubation period. What is an incubation period? An incubation period is, I went out today and I had unprotected sex, and I'm here tonight to get screened. Well, you're not going to be able to tell anything from that incident earlier today. Everything has an incubation period. Like, let's take chlamydia. Chlamydia can be anywhere from 1 to 3 weeks. Gonorrhea is like 2 to 6 weeks. So like everything has an incubation period. So if somebody has a recent exposure, I always tell them, typically they'll come within a week, right? And in that case, I can do chlamydia and gonorrhea. But if they want to have a baseline blood work, that's fine. But then I tell them that they should rescreen in 3 months, and then another 3 months after that. So that way you kind of get through it all, okay? So that's something that's really, really important to realize as well, okay? So I want to talk about Trichomoniasis. Trichomoniasis is something that's sexually transmitted. We get it from having an exchange of body fluids. The symptoms of it, again, sometimes are no symptoms at all. The majority of any of these STDs, for the most part, can have no symptoms at all. To a lot of women have had bacterial infections. They've had that infection where you have like that fishy kind of smell, and it's like yellow and creamy kind of discharge, okay? Trichomoniasis is basically, if you're going to have symptoms, you're going to have those same kind of symptoms with BV, possibly if you're having symptoms such as the yellow creamy discharge, a fishy discharge. Sometimes people have pain with sex. Sometimes people have irregular spotting in between their periods, or they have spotting after sex. And again, sometimes people don't have anything at all. So what I want to do is, because I got this new great system, I want to show you a picture of a trichomonian. It's not too, I've got some other pictures when we go to other things that, I'll put that warning out there. It's not the, the greatest looking thing, but this is a microscope slide of a trichomoniasis. Okay, so I'm going to really quick go over to there. Okay. Actually show people this, they may go, oh my God, I got to make sure that I use condoms and protect myself. So That's basically what a trichomonad looks like, and it's a protozoan, and it moves around. That flagellae kind of move around all over the place, and we can see that under the microscope. If you don't have a microscope, typically if you're having vaginal discharge, we'll do like a vaginal swab and send it off to the lab, and it'll typically test for yeast, bacterial infection, and trichomonas. Now, sometimes a pap smear will come back with trichomonas, like it'll say normal, negative, and then it'll say trichomonas present. I personally do not take that as a confirmed diagnosis. I have the patient come back in. I explain to them this is what the pap smear is saying, but it's not a test for trichomonas. So let's actually do a swab, or if I'm working in a setting where I have a microscope, then I actually look under the microscope because, it's a sexually transmitted infection. And I think we should test with the appropriate testing to make sure that that's exactly what's going on. So that is personally what I do. Once it comes back, if it confirms it, great, then we talk about it. Their partner needs to get treated as well. That's very important, because if your partner doesn't get treated and then you get treated and you have sex again, well, bam, there you go. You're going to have it again. So that's really important when we talk about STDs. Very, very important that we get our partners. Like, it's important that if you get diagnosed, you have to make sure that you talk to your partner about it and make sure that they get treated as well. Some infections, as a GYN provider, if they're not my patient, I can give a script, such as like the state of New York allows us to prescribe. It's called expedite partner treatment, where I can give a script for an antibiotic for chlamydia. But typically, most of the time, their providers the patient has to go to their provider to get a prescription. But if the patient is there with them and I can ask them, are you allergic to anything? What's going on? Typically, to me, it's more important to get the both of them treated than, anything else, because we want to prevent STDs. We want to prevent them from transmitting further and further. Okay. So Trichomonas is actually treated with the same antibiotic that a bacterial infection is treated. It has to be the oral medication. When you have a bacterial infection, you can actually get a vaginal cream, but it does not work when it comes to Trichomonas. Okay, so you will get, typically it's a single dose, a very large dose antibiotic, and it can be a little harsh on the belly. Typically, a lot of the times when people get treated for something, we don't need to do what's called a tested cure. And typically that single dose will eradicate the trichomonas. But usually I will recommend people to come back in 2 to 3 weeks just to get retested to make sure. Couple reasons. One, you want to make sure that their partner got treated and they abstained from sex for at least a week after treatment, so that they just don't reinfect each other. And I have found in the past, there have been times when the single dose just didn't cut it, and they end up having to take a twice a day regime for 7 days. So I typically have people just come back in 2 or 3 weeks and just retest and make sure that it's completely eradicated. Hopefully that all makes sense. All right. I think that's about enough for Trichomonas. The next one I want to talk about, I want to really briefly talk about it in the essence of HIV. A lot of people know about HIV. It's all over. It's still very prevalent. People are getting diagnosed with it still every day. The one thing that I want to kind of talk about is that, because I'm not sure a lot of people know about this, there are 2 different medication regimes for people who are not positive, but are one. Let's just suppose there's 2. It's called, one is called PrEP, PrEP, and one's called PEP, PEP. Now, PEP, PEP is basically, let's suppose I have unprotected sex with someone today, and afterwards they tell me they're HIV positive. Okay. if I go to my provider within 72 hours, it's so important that you need to get to a medical provider like as soon as possible. Then you can be given medication, which is basically HIV medications, or the antiviral medications, and they are medications that are given to people who have HIV. And I think that the last time, I think it's about, you would take it about for 30 days. And if you take that as soon as possible, then the chances of you actually getting HIV is decreased significantly. The thing with the medication, can be pretty harsh on the belly. So sometimes it makes people really nauseous and makes them not feel good. That's the only downside about it. But if you've been possibly exposed, and there's lots of ways people can be exposed, even a healthcare provider with a needle stick, it could be as simple as that. Or, like I said, if you've had either unprotected sex or, and then someone told you they were positive, which it does happen out there, ladies. It happens. So if that were to ever happen to you, then make sure that you get to your medical provider as soon as possible so that you can get that PEP to help you prevent getting HIV. The other form of it, which I mentioned is PrEP, P-R-E-P, is that you can take, let's just suppose I have a partner, and suppose that he's HIV positive and I'm HIV negative, and so, we want to have sex, we're in a long-term relationship, and we want to have unprotected sex. That's a possible scenario, okay? Now, PrEP is something that I can take on a daily basis to help prevent me from contracting HIV. Now, it decreases the incidence about 90%. You do have to take it daily. It's not like you can say, oh, we're going to have sex tonight, let me pop my pill. It doesn't kind of work that way. You actually have to take it for at least 20 days for maximal effects. That's 20 days. I just wanted to check my notes. It's 20 days. So you actually have to make sure that you take it for at least 20 days. Then if you're going to have that unprotected sex, it's going to decrease the incidence of you actually contracting HIV about 90%. Okay? But again, you have to take it every day. It's not the greatest medication. It can cause you to get kind of sick to the belly. It's not the greatest, unfortunately. Okay, so that's all I really wanted to kind of say about herpes, because I think that a lot of people don't even realize that those medications actually exist. And HIV is still out there, it's people are still being diagnosed. I know people are more aware, and hopefully they're using condoms, as I always promote, especially in new relationships. But it's out there, and we really need to protect ourselves. Now, the great thing about HIV is if someone were to contract HIV, the life expectancy with someone with HIV is the same as someone that's a diabetic these days. I mean, the advances that they have come to when it comes to HIV has been amazing. And it really has come a long, long way. So, it's not like back a long time ago, it was be like, oh my God, it's like a death sentence. I'm going to get sick and I'm going to pass, I'm going to die. It's not so much like that anymore. As long as you're taking care of yourself. As long as you follow up with your provider, make sure if you need to take your medications, you take your medications, whatever it is that you got to do. I always tell people, if you're HIV positive and you're following your doctor's advice, the chances of you getting sick it's minimal. Science is an amazing thing. Okay. One thing I do want to mention is that typically when I talk about things, I'll only talk about, conventional ways to treat things, like with an antibiotic, or a prescription of this and that. And I also then go the natural way. When it comes to these infections, I am not going to be talking about natural remedies, because I think that when it comes to STDs, it is so important that we go to our provider and we actually get treated with the antibiotics or the antiviral medications, whatever it is that you need. Definitely, like when it comes to chlamydia, when it comes to gonorrhea, when it comes to HIV, when it comes to Trichomoniasis, when it comes to syphilis, which we haven't even got to. The only exception that I'll put, which we're going to dive right into right now, is herpes. I have done a whole show on herpes, but I definitely want to touch base on herpes again because it's something that is prevalent. It's out there. A lot of people don't know that they have it, and I'm going to show you a slide. Now this one, I've got a slide of what herpes looks like, but I wanted to show you a slide of, hold on, where's my little mouse here? I wanted to show, let me get it up here, okay, and, nope, hold on. All right, here we go. All right, I want to show you a slide. Okay, first off, STD testing, the majority of people, providers, are not going to test you for herpes. So let's see, wait a minute. I think that, let me bring the fishes on. Okay, so wait a minute. Let me go, I'm going to go back to that slide because I'm answering my own question as I'm asking this stuff. This is important. So many people don't know that they have it because a majority of medical providers are not going to test you for it because of the majority, when it comes to, the CDC actually does not recommend routine screening for herpes because the long-time sequelae, it's not going to do anything really, harmful to you. I mean, yes, you'll have it for the rest of your life, but it's really not going to. It's like, okay, chlamydia can cause infertility. HIV, if it's not diagnosed and treated, you can die from it. Syphilis, if you're not diagnosed and treating for it, it progresses. I mean, it gets even in your brain, you're going to go cuckoo, and you have other major medical problems going on. So when it comes to herpes, it's not like, oh, if you get herpes and 20 years from now, you're going to have this problem. You may still be getting outbreaks, you might not, but there's no major sequelae to it. And therefore, it's not really recommended to get testing. So if you want to get tested, make sure that you ask your medical provider to get tested for it. And I have a thing about herpes. I think everyone should get tested. I think that everyone should be offered the testing, and not everybody is. And that's really, it's one of my little pet peeves. It's one of my pet peeves. And I'm actually, in about 2 weeks, I am having an excellent guest. Her name is Melissa. She is a therapist in Manhattan who reached out to me. She's so sweet. I absolutely adore her. She actually has support groups for women who have been diagnosed with herpes. And we're going to talk about the emotional impact that herpes can have on women when they get diagnosed with it. And it can. There's definitely, I had a patient one time. She didn't need a gynecologist, but she came and visited me very frequently after because she was just trying to adjust to, like, she couldn't believe that she was diagnosed with herpes. Then she met somebody. How am I going to talk about this? I mean, it was very traumatic for her. So, hi, Fiona. How are you? I hope that you are doing well. Welcome to the show. We're doing STD talk today. One of my favorite things. I love talking and educating people about things. So having this show has been a wonderful pleasure for me because I love talking. I love telling people as much as I know. I'm not much of a writer. I try to write articles and stuff like that. I'm not that much of a writer. I think I'm more, here I am, let's talk. So anyway, that's it about herpes. I mean, I've had a whole show about herpes. I just wanted to kind of touch base on herpes and just say that, make sure that you get tested. My newsletter this month, I do have now, because we're just talking about natural stuff, natural remedy kind of stuff. Now, herpes is not something that we can get rid of. You will have it for the rest of your life. But there are ways to, if you want to take prescription medications for it, you can absolutely take prescription medications to help with outbreaks or to help prevent outbreaks. But there are actually a lot of natural stuff that we can do to help prevent outbreaks. And then when we have outbreaks that we can do, like with essential oils, what we can do with like essential oils. You've got lavender, you've got peppermint, there's lots of ones with like antiviral properties in them that you can actually take and put them in with a little what we call carrier oil and mix it and just put on lesions to help heal them. There is also herbs like lemon balm, and then there's foods that you can take, like foods that are high in lysine, zinc, vitamin C. You're like kind of boosting up your immune system. So I did if you haven't signed up for our newsletter, go to womenshealthonthego.com, sign up for our newsletter. And this month you will get a great article, one from Melissa. She's going to be coming on the show, but she wrote an article about herpes and the emotional impact that it has. And then also I did a thing about natural remedies on how to take care of outbreaks and how to just kind of boost your immune system up so to help prevent outbreaks from happening. So make sure that you go over there and get that. Okay, next let's talk about, I have about 2 minutes left, which there's so much to say, there's so much to talk about. I think that we're going to end there because my next conversation I was going to have is about HPV, and then we still have to talk about hepatitis, and we still have to talk about syphilis. We got lots of STDs out there, my friends. I did a show about HPV. HPV is the human papillomavirus. It's the virus that we get from having skin-to-skin contact with somebody who has the virus. 80% of the female population is going to come in contact and be exposed and become positive for the HPV virus at some point in their lifetime. Now, I do have to get my newer statistics, but I think it was about my last population statistics in the U.S. was about 3 years ago. And I think there's like 156 million women around there in the United States. So 80% of them, 80%, you can imagine how many people that is going to get HPV at some point in their lifetime. Now, statistically, about 12,000, it just seems to be consistent, around 12,000 women a year will be diagnosed with cervical cancer. Now, not that those 12,000 women are just as important as everybody else, but my kind of point with that is that it's a very small portion of people that unfortunately end up having cervical cancer. But HPV is very, 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 very common. So it's something that make sure that you go for your pap smears when you're supposed to. Typically, if you do that, the chances of you getting cervical cancer is very minimal. But it is important that we do realize, because you can have the virus on your fingers, you can have the virus around your mouth, you can have the virus around your genital area. And there is also the whole conversation. Was it Michael Douglas? I think it was Michael Douglas who had throat cancer. And it was linked to the HPV virus. So there's the incident of throat cancer and HPV is very minimal. I wrote it down. I think it's about 7%. 7% will have the HPV virus, and only about 1% will actually get throat cancer. I remember writing that down because it's not my area of expertise. The throat's not. The vagina, that's my area. So anyway, we'll talk more about HPV because then there's also the vaccine to talk about. There's so much. When I started this show, I did not realize that there is so much to talk about when it comes to women's health. Sometimes I'm trying to figure out, what am I going to talk about next week? What is the show going to be about? And there is so much information out there. There's so much stuff. And I have a list of all these guests that I'm going to start lining up that I'm so excited to be having. I have Melissa, again, she's a therapist, and we're going to be talking about the emotional impact that herpes has on us women when we get diagnosed. I've got a health coach coming on to talk about nutrition and about, I had a great conversation with her about healthcare for women in this country, which can be very frustrating, especially for me, as much as I know that it is for everyone out there. But also just talking about nutrition, making you accountable, she helps people make accountable for themselves, and she teaches people how to walk the perimeter of the grocery store. Stay away from the middle. Stay away from the middle. Because all that good stuff is on the outside that we need to be eating. So I've got her coming. I've got a list of people and some of the stuff I'm learning about too. So some of the stuff I'm learning too, which is an awesome thing. When I'm having all these guests and I'm learning about all this stuff, I'm very excited about it. So I hope that, we're slowly getting through STDs. I'm so happy the show's back on. We're having, everything's going good. Next week, we'll probably either continue STD talk because tis the month. This is a little side thing. I'm definitely going to have a show about this. And I know I'm going over time, but hey, who cares? So there's a lot of talk about medical cannabis, right? And so I definitely want to go back and those certification exams and all this kind of stuff. And that's something that I definitely want to do. But then I think to myself, yes, it's something that I want to know, but can it really help with women's health? Where is it going to go for women's health? So I got this, I'm thinking about it, and I get an email from some organization about it, and there are actually a lot of things that it can help with women's health. It talked about breast cancer and about decreasing and preventing the spread of breast cancer, which I thought was really, really interesting. But what I really thought was interesting, that there is this woman so when you take any herb, right? So this is cannabis, this is lemon balm, this is echinacea, this is when you're talking about herbal medicine, right? You have a plant, and I talked about this before, you have a plant, and you have the synergy of the plant, right? And you have all these little components, these chemical components, and this is how pharmaceuticals are created. They find that, chemical component, this works and does this, so they take it out and they make a prescription drug. The problem is that it just has that component in it, and it doesn't have the synergy of all of the plant. And this makes us, the synergy, the body able to process it and have it go through our body, and therefore you're not going to really have side effects. People remember when we watch all those TV shows, there was lots of side effects to all those medications, and that's the reason why. So when it comes to cannabis, there's all these chemical kind of components from it. So there was apparently this woman, I'm going to do more research and we're going to talk about this more, but there was this research done and how she found one of the components from it that actually help women have better orgasms. And she, not everybody might know about cannabis, but there's lots of different strains. There's lots of different, some are stimulating, some are relaxing. They all have different kind of components in it. But she has created it, and the name of it is Sex Pot, which I think is so awesome. But apparently the feel good, like how if you smoke marijuana, you feel a little like, woo, yeah. So this strain doesn't have you come, like, you don't get really high from it, you just get a little bit, but it allows you and your body to enjoy sex, not only enjoy sex, but also have a climactic experience, and apparently it's very good. So I am going to be doing more research about all this because I think that's so important for women to not only have sex, but enjoy it. And sometimes it can be a challenge for women. So I am going to be doing more research, and we are going to be having a show about medical cannabis. I got to do my research. I love researching and I love learning things, but because I want to bring as much information to you guys as possible. All this kind of stuff, this is easy stuff, but stuff that I'm learning as well. I want to make sure that I, give you as much information and the correct information. And I love research. So that's about it. Okay, everybody. Lori, Women's Health on the Go, where we provide telemedicine for women. Make sure you go over to our website, womenshealthonthego.com. Check us out. See what we do. If you need us, please make an appointment. I love doing what I do. I love talking and educating and helping women in every way that I can. So make sure you get over there. If not, we will see you next week. I'm so glad the system is back up and running. I thank you, Donna, for showing up. Thank you, Fiona, and anybody else that was here. You might not have said hello, but that's okay. Thank you for showing up, and thank you for watching our show. And I will see you next week. Take care, everybody, and see you later.